For my presentation, I will be discussing behavior change in exercise. Behavior. Behavior can be defined as anything a person does in response to internal and external events. Most people think that the problem is that people want to change how much exercise or physical activity that they actually do, but they don't always follow through on that action. The potential solution, according to a study that was done, says that detailed action planning, perceived self efficacy, and self regulatory strategies can help people obtain their behavior change as far as health goes. They called this study a bridge that gapped intention behavior together. So basically, they said that these three things, these three factors, planning, uh, maintenance of self efficacy, and action control, can help bridge the gap of intention and behavior. Most behavioral change strategies derive their components from application of the health belief model, the theory of reasoned action slash theory of planned behavior, and the trans theoretical model and social cognitive theory. Self efficacy refers to an individual's belief in his or her capacity to execute behaviors necessary to produce specific performance. The trans theoretical model and self efficacy go hand in hand. The trans theoretical model states that it depends on if someone believes in themselves enough to sustain a set goal and continue to progress through each stage of the model. There are about 6 stages in this model, and they are the pre contemplation, contemplation, preparation, action, maintenance, termination, and relapse. Pre contemplation is you realize that you need to exercise because you would like to be healthier. Contemplation is when you are going to evaluate yourself and say, you know, what do I need to work on? How can I improve my health? Um, what am I lacking? Preparation is when you try to figure out what are your options as far as exercise go. So, what would you like to do to become more physically active? Would you like to swim, bike, box, etc.? Action means that you're going to actually do something about it. So you thought about it, you figured out your options, you know what you need to improve or what you would like to improve on, and now you're going to try to actually do what it is so that you can follow through on your goal. So, are you going to join a health club? Are you going to go to Reds every day? Join a cycling group? Join a yoga group? And how many days a week are you going to do this? Are you going to do it for 2 days, 5 days, 6 days? So then there's maintenance, and maintenance means you're going to continue to work out for the amount of days that you anticipated. And then termination is you're just going to keep it up week after week, day after day, and make it continuous. And then relapse is stress from work, family, or anything is basically going to inhibit you from working out. So it's going to stop the exercise. So, in a case study in Korea, the Korea Center of Disease Control and Prevention used the trans theoretical model, and they wanted to examine senior undergraduate students and their level of exercise. They actually found that their exercise level was quite lacking, and that they were trying to figure out how they can basically start up a um, undergraduate exercise program so that it can increase that. Um, they found that only 18.8% of students were exercising on a day to day basis. Um, they also realized that researchers have used a trans theoretical model in the past and in present research to create exercise programs, and that they had realized that they were working, so they wanted to try it out. So they selected, sorry, they selected 1,000 students in their senior year from 4 universities. And they basically distributed questionnaires, and of the 1,000, only 976 were collected. And then among the 976, it also reduced again to 959. So they only had 959 people who participated in the study. And in conclusion, after they had did this over a period of about 4 months or so, they had realized that um, when exercise change is low, strategies such as giving one on one training or having subjects read relevant books and providing information as needed is what worked. And when exercise behavior change was high, they realized that self efficacy was needed to be heightened in order to achieve that. So another study that I found was the self-determination theory, and this states that in order to maintain behavior over time, one needs to incorporate skills and values as well as self-determination. So basically, these people from a university did this theory, and they realized that they had patients. Um, and they found that if they tried to maximize autonomy, competence, and relatedness in healthcare settings, that they would be able to change their behavior as far as exercise goes. And so they realized that autonomy was important, and competence was also important, and then their related in health care was important because people could relate to if they found other people or found other things to relate to, then they were going to be more willing to change their mindset in order to actually follow through on their behavior change when it came to exercise. Um, it focused on basically the self determination theory focused on a process through which a person acquires motivation for initializing and initiating new health related behaviors and maintaining them over a long period of time. So they kind of found that this theory helped people to not just follow through on the action and say, okay, yes, I did this, but also to be able to maintain their, you know, change over a longer period. I also looked at another study, and basically it was a cardiac rehabilitation study, and their objective was to um, after cardiac patients had been released from rehab and they were discharged, they wanted them to continue or to start a daily exercise plan, and they wanted to see if patients were going to be able to do this by doing two longitudinal studies. And so the first one was action planning by itself. And then it was a combination, the second one was a combination of action planning and coping planning. And so the action planning was just, okay, this is what I'm going to do. And then that was it. And then the action planning and coping planning was, this is what I'm going to do. And this is why and how, try to get like some type of understanding base so that they can actually follow through on the plan. And after they did the study, they found that the group because they just randomly selected people to do the study after they were discharged. They found that the second group, who did the action planning and the coping planning combined, actually thrived better than the first group, who just did the action planning alone. And so, just from doing research, it made sense, because if you're just saying like, hey, I'm going to do this, it's not going to be as effective as making a plan and then trying to find reasoning and understanding and ways and tools to help you actually execute that plan. When they did the study, it was only a total of 211 patients, and like I said, it was 2 months after they got discharged. So in conclusion, I feel as if behavior change and exercise takes action, it takes planning, and it takes self-efficacy. You need to be able to be self-determined and have a lot of confidence that you can be able to do this and to overcome this in order to set a goal and to follow through on the goal. Thank you, and hope you enjoyed my presentation.